The problem has been as well in this disease management model is that we somehow have faked ourselves into believing that I have a pill or I have a surgery and I'm going to apply this same thing to the masses. But the masses aren't equal, are they?
Exactly. And I think one of the things that it boils down to is the famous ACEs study, where they looked at people who had early developmental childhood trauma, and they saw that those people were much more prone to have chronic disease states later in life. So when we look at how people perceive the best procedure in the world, but how do they manage that procedure and how do they manage their subsequent pain? I think a lot of it, when we look at individuals, we've got to look at their early childhood trauma because that early childhood trauma affects the development of the brain, particularly the amygdala, which senses fear, the prefrontal cortex, which looks at cognitions and how people process. And when we look at that early childhood trauma, if it hasn't been addressed, their perception of pain, no matter what happens, is going to be much higher. So, by addressing the early childhood trauma and those brain structures, we also address how people are perceiving their pain.